The toolkit for combating migraine attacks has expanded in recent years, with the arrival of several newer acute therapies. An acute therapy is not something taken on a daily basis. Rather, it's a medication taken to treat migraine pain and other symptoms when they come on. And two newer medication classes, gepants and ditans, are great tools to consider. Gepants block CGRP, the naturally occurring protein believed to trigger migraine attacks. CGRP is released from nerve cells along the trigeminal nerve, which represents a part of the migraine pathway. Gepants work by blocking CGRP from attaching to other nerve cells, which interrupts one of the key steps in the migraine attack. Currently, there are two FDA-approved gepants available, rimegepant and ubrogepant. The strengths of these medications are that they have good efficacy and an extremely low side effect profile. In fact, the only side effects are nausea and sleepiness, both of which only occur in 3% of patients. Another benefit of gepants is that they have a low likelihood of causing rebound headaches, which are headaches that are worsened by taking your acute med. It is thought that if you are using acute medications more than 2 days per week for several months, that you can develop rebound headaches. So if you experience a lot of side effects or are at risk for developing rebound headaches, then gepants would be a great option to try. Also, they are not contraindicated in patients that have heart disease, like with triptans. Ditans are the other newer class of medication. Currently, lasmiditan is the only FDA-approved ditan available. The strengths of lasmiditan are that it has good efficacy, including a high likelihood that you'll be pain-free at 2 hours. Also, like the gepants, there's no cardiovascular contraindication for this drug, meaning that there is no reason to avoid this medication if you have heart disease or cardiovascular issues. The downside with lasmiditan is that it has a higher side effect profile, which includes dizziness, sleepiness, and pins and needles in your fingertips. As a result, there's an 8-hour driving restriction, so it might be best to use this medication right before sleep, or when you don't have to drive. Both gepants and ditans have an important place in acute migraine treatment and could represent great options for you. To learn more about these and other acute therapies, please contact the National Headache Foundation or visit us online at headaches.org.